Good evening, President Talavera, school board members, executive cabinet, Superintendent Dr. Pleca, and all families present and listening. This evening, program specialist Jackie Gallardo Hoffmaster and myself, Erlinda Soltero Reese, will be celebrating with you the accomplishments of the year 2 of the Community Schools Implementation Grant. And please, I apologize for my voice right now. Still trying to get over whatever it is that's there. So this is our vision statement from the original application, and it's reflective upon year 1 and how to move the work forward. So we started off with this vision, and we're going to take a look at it again once we start working with our new cohort that we have introduced. So we'll be looking into that. Our 6 schools that participated in this first cohort are Commonwealth, Maple, Nicholas, Richmond, Valencia Park, and Woodcrest. So these are the initial framework topics within the original pillars of the Community Schools Grant, and they are related to integrating support services, collaborative leadership practices, active family community involvement, and expanding learning. These are areas we have implemented with staffing and the layering of support services at our participating school sites. As we move forward with the community schools, now the focus will be on these 5 capacity building strategies for the community schools. The shared commitment works along the lines of aligning our district, board, and LCAP goals to address our student needs. Centering community-centered learning. This would involve in honoring our students' narratives in their actual learning, so getting into the classrooms a bit more. Collaborative leadership and practices. This involves the district-wide steering committee and launching a school site-based community schools advisory group. So each school has to have an advisory group now attached to its community schools. And then sustaining staffing and resources. We have a team of 10 that has worked diligently, and they're looking at future funding. We're looking at future funding opportunities to see how we can keep the staffing and programming within our districts. It's all involving the sustaining of the programs. The strategic community partnerships, now that we have completed our needs assessment, connecting with specific support services and resources, we're tailoring everything to those needs that our communities have. Now, our Nicholas Community Center has been there for now 2 years. It is a space, if you have not been there, a biophilic well space. All these services are available to our community. One thing that we did add was extended hours on Tuesdays and Thursdays from 4:30 to 5:30, because we saw that need where parents were coming in after and asking for the assistant after school hours. So we wanted to make sure to have that available for our families as well. And the space is available for our Nicholas students during nutrition and lunchtime. And they come in and they use it, and they truly enjoy it. Jackie's going to take us through services that we have offered for our families and our students, and we'll be going over all the statistics that we have gathered for you.
Erlinda,
Yes.
Could you tell me, you said that the students come in during the day and they use it. Could you give me a couple examples of how they use it?
They'll come in either for counseling services or for recently when we were dispersing their glasses, they would come in to get their glasses during that opportunity. If not, they come in, they feel a safe space where they go and they just relax and enjoy the calmness and the environment where during school they're stressing or they're running around, and this is just an opportunity for them to just sit and enjoy the space.
Thanks a lot.
Okay, and it's so popular that we had to put a cap on how many students could join us because we had lines of about 25 students coming to the center. So I think it just speaks to the volumes of having a safe space on campus where our students could come to access the support services. So we're really glad that the students are being able to take advantage of the space at Nicholas. We wanted to share with you that we have our team of 10, and we have a couple here in the audience today that has been so kind to come during their summer break to support our program. So we have a team of 10 FSD staff. We have a specialized and trained mental health staff equipped to deal with our students and families in need. We have 3 credentialed school counselors. We have 3 social service assistants. We have 1 school nurse, 1 community liaison, 1 clerk 2, and a program specialist. So combined, we are your community schools team that is available. This year, we really worked on getting out to the community so our families knew how we could provide support. So we created this bilingual flyer here to match our biophilic and natural element design to kind of share with our families how they could access us and what our different support services we offer in terms of health, well-being, counseling, and parenting classes. With this flyer, we created a QR code and a bit.ly for us to be able to gauge what are the needs that our FSD families are in need of, that are barriers perhaps in the learning environment. So we wanted to share with you a snapshot. I know this is a lot, but I would like to just draw your attention to the total amount of requests received. Any family, students, staff, community members could refer for requests for assistance on behalf of our community schools team. And you'll see the different areas of what the requests were asked for in a variety of needs from TK through 8th grade, and then also amongst our 6 participating school sites. But we also had families from other FSD school sites that asked for assistance. And the top 3 areas of requests were addressing academic, attendance, social emotional needs, mental health, and physical health. So this was a way that our team could triage need and response to connect that family and students with the service. Next, we wanted to share with you a little bit about the health partnerships we've been able to roll out this school year. So we were super excited to launch a Vision to Learn as a community partnership. And this is a mobile health clinic that comes on campus and provides vision, access, and health screening, and the addition of eye exams. And if students qualified, they get their prescriptive lenses. We are super excited that our school nurse, Rosalind, took the charge within 6 schools to orchestrate this monster planning, and we were successfully able to take, if not 2 or 3 mobile units to 6 of our campuses this past spring to have students all screened, and then follow up with an eye exam, and then also follow up with vision fitting and selection of glasses. A third of our students on campus were eligible for glasses to receive these services. We had 35% on each of our 6 campuses that had failed the vision screening. And so that 30% of students on each of our 6 school campuses received their glasses. And it was the neatest thing to see these kiddos come onto the van, choose their glasses, pink, clear frames. I think the junior high vibe was the clear frames. They were very popular. And then also get the education about how to use the glasses, how to care for them. And these glasses will have coverage of insurance for 1 year. So within the upcoming school year, if any of our students broke or scratched their glasses, we're able to connect the family so that they could get a replacement for those glasses. So this has been very great to see, because we know sometimes our kiddos, the barrier to learning could be that health access, and being able to bring the vision on campus. We had some students that said, oh my gosh, I can see the board now, or oh, my friend always looked blurry, and is this normal? We're like, no, this is good. We're just, it's going to take 3 weeks of the glasses. And it was just really neat, as you'll see later in our presentation, to see the students being able to access their vision in a clear, crisp lens.
Jackie,
yes.
Sorry, real quick. Was this grade specific for this?
We did kindergarten through 8th grade. Yes. And because and TK as well. Yes. And I know our preschooler has a different partnership, but we were able to include TK as well.
As I'm looking at it, the total, I don't know if it was said because this charts are hard to read, but 668 pairs of glasses that were given to our
Yes.
students.
Mm-hmm.
668 kids that can now see better. That's amazing.
Yes,
That's
yes,
wonderful.
it was a definite silver lining to see all the
Thank
kiddos
you.
on campus with their little cases, and it said a sticker 50% or 100% of the usage of their glasses. So, yes, it was really exciting.
I wanted to give one shout out. When I was over there, we were talking about where the money comes from, and there are, I believe, 5 teams, professional sports teams, that will give money to this foundation. And the one that funded our glasses, at least the ones at Maple, were the Clippers. So I'd like to give a shout out of thanks to the Clippers for donating the money so that our wonderful students can now see the board, see his friend across the room, and enjoy life on a higher level.
Yes, that's the power of the community partnerships, definitely, absolutely. Another health service provider we were able to roll out this year was a Big Smiles Dental Mobile Clinic, and we rolled this out specifically as a pilot at Commonwealth Elementary, and there was a dental team that came on campus and was able to provide service of oral exam, cleaning, fluorides, x-rays, and education about oral health. We had a total of 16 students on campus come visit a classroom on campus that got totally converted into a dental office, free of charge for our students and families who were participating with big smiles. And it just was great to see our team come into action to support this. Also the support of Principal Summy, being able to offer the support for our families, whether they had insurance or not, or that connection with insurance. And this is a goal we'd like to expand for next year, to be able to offer this mobile access of dental hygiene on campus. So we will be continuing this partnership next year with hopefully more of our school sites. In addition, we were able to also roll out our Vax to School mobile clinic, which was on campus, most recently at Nicholas Junior High. We had a total of 32 families sign up to provide the vaccinations that were pending for our incoming students. And so it just really shows the accessibility to provide the service on campus, to really reduce the barriers for our students to be able to access their learning, so that they're not missing school to go to an appointment, to be able to access that appointment during the school day. So that's really the beauty of all these services, that we're able to bring them on campus, so our students wouldn't be missing instructional time for these services, and again, free of charge, all these services. Another partnership we were happy to onboard this year was the Community Health Initiative of Orange County, and we were able to connect 68 families with health insurance enrollment benefits for Medi-Cal, CalFresh, CalWorks, Covered California, and General Relief. And we had representatives come on campus to our Nicholas Community Center to actually sign the families up on site. So our community center served as a hub space to be able to connect our families, bring your documents, and get them connected to services as soon as possible. And this will be a continuing partnership for next year, so our school sites know they have this accessibility at their school sites. And then we wanted to highlight Fullerton Express Pharmacy, as that's a local pharmacy partner here in Fullerton. We're able to connect 21 requests for our families in need of health and hygiene to provide the education and access to health care for the students to feel better in order to not miss school and come and access their learning.
With all of these wonderful programs, I'm so impressed by you guys. All of the people you got to connect with us and give their time. Some of them were as few as 16 kids, and others were larger. How were these children selected? Was it self-selection? Their parents came in and signed them up? Were we limited?
So not limited. We created like a bit.ly and a flyer to advertise to the communities, and we had our families sign up. We also used our community schools team to outreach to families we knew that might be in the need of services, but also we wanted to sign up as many families as we could. And really with these partnerships, there is no cap. It's just the coordination of getting them signed up, coordinated, and connecting with their insurance provider to make sure they had access. And if they didn't have health insurance access, we were able to connect them to get enrolled.
Well, hats off to you guys, really.
Thank you, thank you. So now we're going to move a little bit into our integrated support services, which is our team services, what we're able to provide. So in the area of parenting classes, as you see, we were able to offer several opportunities for our parents to have knowledge and feel connected with their learning with their child. So we started with Poder with Chalk, which is an educational program that provides healthy topics and lifestyles for our families to learn about diabetes awareness and prevention. And we had 54 parents participate in our Chalk classes in partnership. We also had our community liaison facilitate the 10 educational essentials and school smarts to have our families learn about transition from elementary to junior high, also A through G requirements, college requirements, and then we were also able to host 6 workshops with Care Solace as our community partner to address mental health. So families learned what are warning signs in children and family members if they're struggling with mental health, and how they can get help and connected here at the district, and also navigating mental health in our family and grief and loss during the holidays. So this was just a different opportunity for us to offer both the mental health component to our families, but also the physical health, and also how to get engaged with the school learning in the different learning programs we offer at our 6 school sites. So now we're going to move a little bit to our continued partnership with Care Solace, and we just wanted to share again a snapshot, even though I know this is a lot of numbers, but we wanted to show you just the need we've seen at our schools. And this is a data management system that we use that's called Care Solace Loop Plus, where our team is able to log interventions or direct services. And the highlight here is that we had 3,287 services logged from our school nurse, our clerk, our school counselors, and our social service assistants. And the top 3 areas for need were health, social emotional needs, and family outreach and contacts. So just kind of shares with you a little bit of that direct service and the time that we've given to really provide that support for our FSD families. And then when it comes to our direct school counseling and our social service assistants, what we wanted to highlight here is just having that direct staff available at the school site to address students in crisis and connect them with the counseling needs. And so we're able to have 146 students in individual short-term counseling with our school counselors, and they helped 44 students that were in crisis to establish safety and general well-being. And then with our social service assistants, we had 1,617 calls and in-person meetings for our needs assessment, phone banking, and outreach. And I just think it speaks to the trust and the rapport that our team was available to provide in person, that physical connection, so the families see a friendly face on campus and they're able to come and let us know what's going on so we can provide that support for them. So next slide is our Daybreak Health, and I apologize, got a little bit cut off on the top, but this is another community partnership we have that provides teletherapy for our students and families, and we're super proud to share that we had 77 referrals within our 6 school sites completed that covered 12 counseling sessions. We had 2 models of support. We had individual counseling for students ages 10 and up, and then we had a family therapy counseling program that addressed students as young as 5 and up. And so as you see here, again, the 3 top areas of need for our families was students dealing with feelings of sadness, anger management, and stress or worry. And so just again, speaking to that need of the whole child needs and how we're able to provide these partnerships and support services to help our students so they have the support, the coping skills, so they can come to school, they can feel ready to learn, but they also know they have that safe person to speak with.
Now, are these students who came to anger management, are they self-referred, family referred, or school referred?
These can be a combination of all of those. This service we have in a flyer, we advertise to the school sites. Some referrals have been self-referred from students. Some parents came with concerns, and then also working with the school site teams where maybe they've seen a need or a change in, Jackie's behavior. They notice something might be different. They'd like to connect them with the resource. So we've been able to address self-referrals, family referrals, and staff referrals as well.
Great.
So we see all the great numbers, but oftentimes I think we need to take a step and really see if we're making that true impact. So after 12 sessions that our students have had with the teletherapy, they were asked a question. And this is when you know that we're headed in the right direction, we're doing what we can, we're helping when we can, and making this available for our students any which way we can. So the teletherapy services asked our students one question. If you had a magic wand, what would you do? What would you make disappear? What would you make stop? Some of these answers that the students answered were truly very personal, but because they felt comfortable enough, they were able to answer the question. If I had a magic wand, I would want to be less angry. I would want to change the way I am, my face, my body, and all of the insecurity. If I had a wand, I would not be getting into fights. I would stop the bullying. I would be more social. These were true statements from our students. So we were just celebrating the moment where they were able to open up to that teletherapy person, and we are able to extend services over the summer to our students. So the summer's coming up. What do we do? What can we keep going with? So we told the parents, this is going to be continuous throughout the summer. You're not alone. We added an extra little widget at the bottom of our website. These are all the different places that you can go for help. If we're not there to answer, we've asked that phone calls be forwarded so that they have somebody to go to still. So we wanted to ensure that because of these stories that we've heard personally from our own students. So moving along to new partnerships, new options that we have had the opportunity to be a part of. So one of our new community partnerships and extended is with St. Jude, and they have provided us with $32,000, and this is for portable freezer storage units that are going to be added to some of our school sites, Commonwealth, Valencia Park, and Woodcrest, and they are going to be for their mobile food pantries. And we are excited to announce that Nicholas has been awarded the opportunity to be part of the mobile school pantries, so Nicholas will be on board as well. Additionally, we have received, we will be receiving $140,000 over 2 years to be able to bring in more community engagement. The focus school is going to be Commonwealth to ensure that they have advisory groups that are going to be trained to bring in more families to see the concerns, where can we help, what's the additional training and professional learning that parents need, attendance being one of them, a major component. Do they know how to navigate the school system? These are community engagement initiatives that we are going to have available to provide peer leading and a learning network for our school Commonwealth. And then hopefully we'll be receiving more funds for that as well. Building relationships and building trust there. And then our next steps that we have outlined here, we're going to be continuing our partnerships and district steering committee to have that collaborative voice and multiple voices from our community and leadership. We have received 2,232 responses for our needs assessment survey. So this is a lot of data that we will be going through to see what else we can offer our community, our students, our parents, and to see what services we can look for additionally as well. And we're going to be tailoring our community partnerships for each school site to address student well-being. And then the big announcement is we have been awarded cohort 3 2 schools Orange Thorpe and Pacific Drive, and the big number there is $2,850,000, so that we can make sure that we incorporate these two schools now into our community center and incorporate all of the services. We will be adding them on as well, so that they have that opportunity to receive all that their students need in addition to.
Wow. And that brings us to a total of 8 schools?
Yes, we're just missing one school. So once it gets, the opportunity arises again, we will be applying once more for any additional schools that will qualify. So next we have a little short video to conclude, just so that you are able to see all the work that we have done. And with Jackie exiting us now, I wanted to introduce Jenny Saul, who's going to be a new program specialist that will be working with me on the community schools. But we want to offer Jackie a huge thank you for all that she has done and continuing the work. So you can play that.
Thank you all so much. Just wow. Definitely wow. Awesome. We're going to move on to superintendent's report.
Again, just to thank the whole crew. I know I want a special shout out to the whole summer school, and I know it is going alive and well, and so appreciate all the work that they're doing for that, both enrichment as well as interventions, as well as ELD, a whole variety of opportunities for our kids. So thanks to our entire team, classified, certificated, management, all putting that together. Thanks, everybody.
Thank you so much. Information from our Board of Trustees, and I'm going to start from our right to left since we got Bev on the phone and I have an echo.
Want me to start? Okay. Well, thank you so much for that report. That was so moving and just inspiring to see how we're caring for our kids and our communities. Thank you so, so much for all the hard work. I mean, thinking about those, the question, we don't have a magic wand, but we certainly have a lot of resources and amazing opportunities through these partnerships that you've created. People who are generous and this is staff that care. Thank you so much for caring for our kids and our families. And I think building those relationships, creating that trust is really the key to that. So you've done an excellent job. Thank you, Jackie. Thank you, team, for putting all that hard work in and creating these opportunities for our kids and our parents. Really, really appreciate it.